Welcome to our deep dive into feline infectious peritonitis. We're looking at a study on the factors that influence short-term mortality in cats diagnosed with it.
Yes, it's a fascinating study that offers insights, I think, for both veterinarians and cat owners.
It focuses on cats treated with remdesivir or GS-441524. And these are antiviral medications showing promise in treating FIP. What's really compelling is this study tries to identify factors that predict which cats are more likely to die within 84 days of starting treatment.
Yeah, that's right. And this information could be really crucial, helping vets make more informed decisions about treatment and give owners a clearer understanding of their cat's prognosis.
One of the most interesting findings was the role of a blood test, a common one, measuring lactate dehydrogenase, or LDH.
Right.
Can you tell us more about that?
Sure. So LDH is an enzyme found in different body tissues. When cells get damaged, LDH is released into the blood. So elevated LDH levels, they often mean there's cellular damage happening.
So that means, in the case of FIP, high LDH would suggest severe inflammation and damage caused by the virus.
Exactly. The study actually found that cats with higher LDH at the start of treatment were much more likely to die within that 84-day period. They even identified a specific level, 323 UL, like cats with levels above that faced a much higher risk.
Wow, that's a very specific number, and potentially a really powerful tool. It's interesting that a routine blood test can offer such valuable insights into a cat's chances of survival.
Right. And, it kind of shows the complexity of FIP. We're still trying to understand the disease. But this finding doesn't mean high LDH directly causes death, but it strongly suggests it's connected to disease severity.
So it seems like vets could change how they approach FIP cases. Imagine being able to find those high-risk cats early and maybe adjust treatment.
Yeah, that's the crux of the matter. This finding could lead to more personalized treatments tailored to a cat's risk.
The study didn't just look at LDH, though, right? They looked at other risk factors.
Yes, they did. They looked at blood levels of albumin, total protein, sodium, and potassium.
And were any of those as significant as LDH in predicting if a cat would die?
Interestingly, they weren't. Some initially seemed promising, but when they looked closer, they weren't statistically significant. So, for example, cats with lower albumin, total protein, sodium, and potassium did seem to do worse. But when they considered other factors, these differences weren't as important.
So like a red herring in a detective novel. Looks important at first, but it's not the real clue.
Yeah, I like that analogy. They also looked at fever or lack of fever as a predictor.
And I'd assume that fever, which is a sign of inflammation, would be associated with a worse outcome.
You'd think so, but actually cats without a fever were more likely to die.
That's really surprising. Why would no fever be a concern with FIP?
That's the burning question. It definitely challenges what we normally think, and we need to do more research. One possibility is that no fever could mean a suppressed immune response, so the cat's more vulnerable to FIP.
So their immune system's overwhelmed and can't fight the virus properly.
Exactly. It shows how complex the virus and the immune response are, and we need more research to figure out what's really going on.
This study also looked at prednisolone, which is a corticosteroid sometimes used with antiviral treatments for FIP. What did they find about that?
They saw that vets use prednisolone more in cats that didn't survive, but it's important to note that vets are more likely to give prednisolone to very sick cats already. So it's hard to say if prednisolone itself caused the worse outcomes or if those cats were just sicker to begin with.
So it's hard to separate cause and effect in this case.
Yeah, definitely. More research is needed to really clarify what prednisolone does in FIP treatment, the benefits and the risks.
So even though LDH seems like a strong predictor for short-term mortality in this study, we also have to look at the bigger picture, like using medications such as prednisolone and other individual factors that could affect the cat's prognosis.
Exactly. FIP is a complicated disease. This study helps us understand it, but it's not the whole story.
So it seems there's still a lot we don't know about FIP, but this research has given us some clues about what affects survival.
Oh, definitely. This study went beyond just blood work and treatments. They actually looked at the cats themselves, how they presented at the clinic.
Right, they gathered data on things like if there was fluid buildup, problems with their eyes or neurological signs, and their temperature.
Yeah, exactly. And while things like their sex, breed, age, and weight didn't seem to matter for short-term survival, some of their other observations were pretty interesting.
Like, I know fluid buildup or effusions are common in some types of FIP. I would think that would mean a worse outcome.
You would, but surprisingly, the study found it didn't matter for survival if the cats had effusions or not.
So just knowing about effusions doesn't tell us the whole story about how a cat will do.
Exactly. It suggests that there are other things going on that determine if a cat can beat the disease.
What about eye problems or neurological issues? Those seem like they'd really affect a cat's health and chances of surviving.
You'd think so, right? But just like with effusions, these things didn't seem to affect survival in this study.
That's kind of wild. It seems weird that those complications wouldn't make things worse.
It really shows how complicated FIP is. There are so many things that affect how a cat responds to it.
Now, one thing that did seem to matter was body temperature. The study found that cats without fever were more likely to die.
Yeah. Actually, all 4 cats in the study that had a temperature below 37.8 degrees Celsius, which is hypothermia, they died from the disease.
That's really scary. It seems counterintuitive that not having a fever would be a bad sign.
I know. It makes you question what we think about fever being a sign of the body fighting infection. But we've seen similar things in people. When someone with a severe infection has a low temperature, it can mean they're not doing well.
So it could be that the cat's immune system is so weak it can't even create an inflammatory response.
That's a definite possibility. It might mean their immune system is really struggling to handle the virus.
This really shows that vets need to keep a close eye on temperature in cats with FIP and know that hypothermia is a serious problem.
Absolutely. It means we need to start treatment early and give these cats a lot of support.
The study also looked at blood test results, right? Like the clinical pathological parameters.
They did. And it supported the idea that cell damage is linked to mortality in FIP.
Besides LDH, were there other blood tests that were abnormal?
Yeah, cats that didn't survive also had higher bilirubin, which could mean liver problems or that their red blood cells were breaking down.
And what about those other things we talked about, like albumin, total protein, sodium, and potassium?
That's interesting. Cats that didn't survive had lower levels of all of those, but when they considered LDH, those differences weren't as important statistically.
So it seems like those other blood tests might give us a clue, but LDH is still the most reliable indicator in this study.
That's a good summary. They also looked at whether high LDH could be related to acute respiratory distress syndrome, or ARDS.
ARDS is when the lungs get really inflamed and filled with fluid. Is there a connection between LDH and ARDS in cats with FIP?
We don't know for sure yet, but there were 4 cats in the study with breathing problems, and their chest x-rays showed lung problems. They also ruled out heart problems using an echocardiogram. Sadly, 3 of those cats died from respiratory failure, and they all had high LDH, above that 323 UL cutoff.
That's so sad. But it could mean that high LDH is an early warning sign of lung complications in FIP.
That's a possible explanation, but we need to remember that to truly diagnose ARDS, you need specific criteria and blood gas analysis, which they didn't do in this study.
So more research is needed to really understand the link between LDH, ARDS, and mortality in FIP.
Exactly. We need more research to understand how these things are connected and what it means for treatment.
Speaking of treatment, the study mentioned using prednisolone with the antiviral drugs. We talked about that a bit earlier, but can you tell us more about what they found?
They found that cats who didn't survive got prednisolone more often. But, as we said before, vets tend to give prednisolone to cats who are already really sick.
So it's hard to know if prednisolone itself is the problem, or if those cats were just sicker to begin with.
Exactly. It's really complicated, and we need more research to understand how corticosteroids affect FIP treatment.
Okay, so this study tells us a lot about what affects short-term mortality in cats with FIP, but it also brings up a lot of questions that need more research.
You're right. It shows that FIP is complex, and this study gives us valuable information, but it's not the end of the story.
Even with those limitations, this study has opened up some exciting possibilities for research.
Yeah, that's what's so cool about science. Every study adds to what we know.
The idea of targeting LDH with new treatments really caught my attention. Could you say more about that?
Sure. The study suggests that high LDH isn't just a sign that the disease is bad, but it might actually be part of what makes FIP so dangerous.
So instead of just using LDH to tell us how a cat might do, we could try to stop the cell damage that's causing the high LDH in the first place.
Exactly. If we can find treatments that protect cells or help them repair, we might be able to help more cats with FIP survive.
That's really promising. It opens up a whole new way of thinking about FIP treatment.
It really does, and scientists are already looking into different ways to target LDH and stop it from doing damage.
It sounds like we're moving away from just reacting to FIP and toward treatments that attack the disease at its core.
That's the hope, and this study is a big step in that direction.
Besides new therapies, what other research has this study inspired?
Well, one thing is that we need larger, more controlled studies to confirm these findings and really understand why we're seeing these connections.
Especially studies that look at what happens in the long term. We need to know what helps cats stay in remission and have a good quality of life after they've had FIP.
Absolutely, that's essential. This study focused on whether cats survived in the short term, but we still need to learn about the long-term effects of things like high LDH.
It's about making sure those cats have the best chance at a long, healthy life after they've beaten FIP.
Exactly. Another interesting area is the possible link between LDH and ARDS in cats with FIP. We need more research to see if high LDH can really warn us that a cat might develop this serious complication.
If we could identify those cats early, we might be able to treat them more effectively and help them do better.
That's the idea. Early detection and treatment are key when dealing with these kinds of complications.
This has been a really insightful deep dive into the latest FIP research. We've learned so much about the importance of LDH, the challenges of diagnosing and treating FIP, and the future of FIP research.
It really has been a fascinating discussion. We've seen how far we've come and what we still need to learn about this complex disease.
Any final thoughts for our listener who brought us this great study?
I'd say this research gives us real hope for cats with FIP. It's still a tough disease, but we're understanding it better and coming up with better ways to fight it.
And hopefully, with more research and teamwork, we can get to a point where FIP is no longer a death sentence for our feline friends.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.